I'm Patricia. A question
If I could comment on the telemammography, since that's our work, actually we have contracts with several sites throughout the state with telemammography, and what we've been able to do is really deliver the majority of those reads within the hour. And the way that I think that has really transformed the delivery of healthcare in many locations is that women will go and will wait for their results. I think one of the difficulties in the past with mammography and with other services that were not available locally is that there was a significant delay of time so that an abnormality was found, but the patient was not found. This technology really allows us to provide the results in a more real-time fashion. And the patient is there. I think there's a lot of satisfaction. We're actively looking at ways, health delivery models that could bring together teleradiology and telepathology. And again, most of that work has been in women's health. So has been in the area of breast, some in the area of cervix and GYN malignancies. But I think that as Dr. Lance mentioned, this is an area that has a lot of opportunity as far as taking a medical van. We do something similar, for example, for diabetes, where we have diabetes days, and the person can get teleophthalmology, retinal screening, get blood sugar, and participate in a telenutrition education session. So a lot of ways to work with health.
Dr. Lopez, I'm Patricia Goubeau, and my question is because the reading x-rays and mammograms is very impersonal, but I'm wondering in terms of the value with personal consultation, but I'm one that's still of the age that one-on-one, face-to-face is my preferred mode of communicating, and I'm just wondering what your experience is with people who are resistant to actually having their consultation through telemedicine.
I think that's really a great question, and it's also, as a clinician who loves to see patients, that was really one of my big hesitancies when we first began the program, is how would that work? And I'll share with you just a couple of experiences. I think there can be hesitancy on the patient end, and I think there can be hesitancy on the clinician end. And when we have a new clinician, where we have our consultative site is in the medical library on the first floor. So I meet the new clinicians at the entrance to the library. We go down the stairs, and as we go down the stairs, people are inevitably saying, oh, well, I'm not sure about this. I don't know that this is what I want to be doing. But then they go in, they interact with the patient, it goes great, and as we're coming up the stairs, they'll say, you know what, tell me when I can do this again. So I think doing it is what really helps to make your judgment. As far as patients, I'll share with you a story with pediatric infectious disease, where we were doing these consultations, and this was early on, and the patient is a child. And the child, at the end of the session, the doc asked the child, how did this work for you? Was this okay? What did you miss? And the little girl went up to the camera and just said, all I missed was giving you a hug. And she hugged the camera, or the screen, I guess. But I think that because television is so much a part of our lives, that people are comfortable, and more comfortable than I had expected. So telepsychiatry, I really thought that's going to be hard to do through the network, and yet it's not only very commonly used, not only are there high levels of satisfaction with its use, but many times patients prefer the interaction through telepsychiatry than through in-person when they have a choice of, after they've had a choice, the experience with both and had a choice.
How about the cost factors? Are there,
Cost factor?
is it cost effective?
Yeah, so, yes. I think that, again, really important question. There are multiple ways, as you know, to look at cost data. And that's one of the ways as we're doing these studies that we really want to look at cost efficacy. Clearly, the more the systems are used, the more cost effective they are. And I think, as you are all aware, any technology not only gets better with time, but gets cheaper. In addition, really trying to understand what are the modalities, so that, for example, for the home health unit, for home health work, it's going to be a different type of modality that's going to be used than for video conferencing that we're doing now, for telepathology, different systems, so that if you look at the whole package, this full service package that can do ENT, that can do heart sounds, pulmonary sounds, all of that, that's about $50,000. But if you were looking at a specific application, you wouldn't need all of that. So important to think what is the application and then to find the technology that fits that application. A digital camera and a laptop can really be very, very powerful tools that can do a lot. So again, by using that. The other aspect is the billing. Telemedicine is a billable service. It's a billable service like in person. And in addition to the bill that, let's say, if you were sending a case to the city, that the person into the city could charge, the person sending, there can also be a charge there. So there's a local service fee that can be billed. So there's, by looking at all of these aspects, and then depending on the distance from the site, the availability of services locally, yes, I think that there are data that would say that this is a cost-effective intervention.
Do insurance companies cover this service?
Yes, we have done work with every insurer in the state of Arizona, and I say in the state of Arizona because medical health insurance is state-based. The rules are all by state. Every insurance program reimburses for telemedicine, including access.